everyone, welcome back to the Medicare Space channel. My name is Victoria Cabrera, Medicare insurance agent here in San Antonio, Texas, helping you anywhere you're at in the US with your general Medicare questions, and hopefully I can be a resource to you in any way that I can. If for some reason you're in a state that I cannot help you, I'll definitely get you over to somebody that is very good in that state to help you with any questions you might have. But today I wanted to go over, we talk a lot about some of the Medicare, questions that I run into a lot. And I always try to tackle those questions by providing you guys answers, providing you guys information with any questions that you might have. One of the questions I get a lot, especially when now more than ever that I'm getting phone calls from people all over, and there's still so much confusion on how to choose what you need, especially for those of you that are on Medicare Part A and Part B. And so the question I get is, well, Victoria, how do I choose a health plan? How do I choose between a Medicare supplement and a Medicare Advantage? How do I choose what's right for me? And I'm just going to go over a few brief things that might help you make that and solidify that decision. The great news is you have a resource. I can help you. I work with quite a bit of all the main big top insurance companies. I work with all the Medicare type plans, whether it's Medicare Advantage, Part D, or Medicare Supplement. I work with all of them. But I'm going to give you some tips that I run into a lot when I help customers try to decide which way they need to go. So first step is I always educate them on how Medicare works. That's the number one thing. Because if you understand the foundation, I've gone over this and, what is Medicare and Part A and Part B. I've gone over that stuff. So I'm not going to go over that in this video. If you need to hear that, go to the videos before this, where it talks about all the basics of Medicare. But first is education. The second thing is helping you understand what is a Medicare Advantage plan. Again, there's a video on what is Medicare Advantage. And then the third thing is also helping you understand what a Medicare supplement is. So once you understand what the foundation of Medicare, and then you understand the foundations of Medicare Advantage and the Medicare supplement, it's almost like I like to call it process of elimination, right? It's like, you know the pros and the cons of Medicare Advantage. You also know the pros and the cons of Medicare supplement. And then you can kind of decide, well, Victoria, I don't really travel a lot. I don't see a lot of doctors. I'm trying to really save money. We always want to ask these questions. So here, I'll just make this easy. Here are some of the questions I ask my clients when I'm trying to help them choose a Medicare Advantage or supplement. One, I always ask about their doctors. What doctors are you seeing? What specialist are you seeing? I also ask about prior health history, not too much in depth, but I'll ask you, are you dealing with any existing chronic illnesses or existing conditions that you're taking maintenance drugs for? I also ask you if you're taking any medications. I also ask you, do you travel? Are you a traveler? What is your income like? What's affordable to you? I also ask, what's your preference? A lot of people prefer not to have to stay within a network of providers. They prefer to have the freedom to go wherever they want. So it really comes down to, what is your preference? Do you like convenience, or are you okay with a little bit of inconvenience here and there to save you money every month? Are you the type of person that rather pay now and not have to pay later? I ask that question a lot. There's so much involved. Do you have any history of cancer? Are you in remission? Or have you had cancer in the past? Have you ever had any heart issues? The reason why we ask all these things is not because we want to be nosy about your health insurance situation. It allows us as agents to kind of give a recommendation to where you should go, what we think would be the best option for you. Again, at the end of the day, this is going to be your health plan, right? You have to choose what is right for you. We cannot choose what is right for you. We might have an opinion on what we think is the best for you, but at the end of the day, you have to make that decision, right? We could try to make the decision easier by giving you the benefits of this type of program and that type of program. But I would start by one thing at a time. Again, understanding how Medicare works first, understanding what a Medicare Advantage plan is, right? In a nutshell, a Medicare Advantage plan becomes your primary health insurance. You have to pay copays for each service, right? There's a copay assigned to every medical service. You have to stay within a network of providers, right? In some cases, you have to get a referral. They come in HMOs and PPOs. They have extra benefits that original Medicare doesn't cover, like dental and vision and gym memberships and things like this. In most cases, your prescription drug coverage is included. I've said a lot of good things, and I've said a lot of things that might be like, ooh, Victoria, I don't want to stay within a network of providers. That doesn't work for me. I see specialists. When you go to Medicare Advantage plan, there's a chance that your doctor doesn't take that particular plan. So the plan maybe that you really wanted might not be a viable solution for you because your doctor doesn't take that plan. Whereas on a Medicare supplement, there are no networks. Doesn't matter where you are in the U.S., you have coverage. In most of the plan letters, like Plan G right now, you really don't pay anything out of pocket other than your monthly premium and your Part B deductible. That's it. You don't pay anything else. Zero cost. So if you go to the hospital, if you had a knee surgery, whatever it might be, you pay zero other than your deductible. So these are things to consider, right? Again, in some of the videos, I go into more depth on Medicare Advantage and into more depth on Medicare Supplement. So maybe I confused you even more. That's not the case. I don't want to confuse you even more. But I want to let you know how you as an individual can choose a health plan that's right for you. Now, I always want to give this advice because it happens all the time. You might have a neighbor or a friend or somebody that is, just has been on Medicare for a little bit longer than you have. And they're telling you to go on this plan and go on that plan and you need to do this because this is what I have. But the problem with that is, they might not know all your medical history. They might not know all the medications you're taking. They might not know that your budget. They might not know these things. And, you don't have to tell them that information. They're not your agent. You can tell me that information and, I do this every single day. You can listen to what people have to say, but at the end of the day, you really want to get with a professional that's licensed, that's appointed with these companies that understand the ins and outs of the plans, that understand Medicare, that understand your situation without you feeling embarrassed or having to just not disclose certain information to your friends and family. So remember, at the end of the day, this is your health plan. There's always situations where I meet with the husband and a wife, and the husband goes with the Medicare supplement, and the wife goes with the Medicare Advantage. Two different health situations. You guys don't have to choose the same exact plan. It happens all the time. So to help you how to choose, some of the questions that I ask you will help us determine which way you need to go. It's all process of elimination. I'll tell you what, when you call me, in the first 10 minutes of talking to you, I'll know more or less, probably even the first 5 minutes, but usually the first 10 minutes since I've already kind of asked some of these questions, I will know more or less which route you need to go, whether it's Medicare Advantage or Medicare Supplement. And I'll normally make that recommendation to you. But again, I'm on your side. I'm gonna support you in the decision that you make, and the decision that you make, I'm gonna help you understand that everything in that decision, everything about that plan that you've decided on, and I'm gonna help you understand everything, the cost out of pocket, everything that's included, so that way you're not blindsided with anything down the line. Again, these videos are made to help you. If you found it helpful, please share this video with family and friends that might be dealing or going through the insurance process like you. You can always call me. My email and my phone number are in the messages below. And as always, please hit that subscribe button. It really does help out the channel. If you haven't seen the past videos and you're still confused about what is Medicare, what is Medicare Advantage, what is Medicare Supplement, if you go to those past videos, you'll see that I've laid out a series of videos, very, very basic, simple videos for you to understand. If you still need help, you know how to reach me. Thank you so much for your time, and we'll see you on the next one.